Hello, good afternoon. This is Willie Walker here at HNN and my co-host,
Marquita Stokes.
and we are here today to talk about what?
Cultural competency and cultural humility.
Also, I will be informing you about the Zubik versus Burwell case that is still ongoing at this moment.
Cultural competent care is defined as care that respects diversity in the patient population and cultural factors that can affect health and healthcare, such as language, communication, styles, beliefs, attitudes, and behaviors. The most popular and most well-studied type of cultural competency intervention is cultural competency training for healthcare providers. Reducing health disparities and accomplishing equal human services remains an important goal for the U.S. social insurance framework. Cultural competency is broadly observed as a foundational column for reducing disparities through socially delicate and fair quality care. African Americans, Latinos, and Asian Americans are more likely than whites to report that they believe they would have received better care if they had been of a different race or ethnicity.
Well, Marquita, since we're talking about cultural competence today, can you give me an example of what it is for our listeners and our viewers out here?
Yes, I can, Willie. One good example that I have is that Muslim husbands do not want male doctors looking at their wives because they feel like their wife's body is for their eyes only. They don't understand that really the doctor is there to help. He's not really looking at your wife in any type of way. And most doctors might get a misunderstanding and get all rowdy and upset about it, not understanding that it's not the husband being nasty or anything, but that's his culture. He feels like his wife's body is for his eyes only. So he wouldn't want the doctor to check her out and find out what's wrong with her. And most people would just try to get them kicked out of the hospital or tell them that they have to leave, not understanding that it's not his attitude, it's more of his beliefs or his culture or how he feels.
Okay, so with that being said, do you feel that anytime, say per se, a Muslim comes into a hospital with his wife, you should automatically just assume to have a woman doctor there present?
I wouldn't say to automatically assume that. I would say more of if you have more knowledge of what's going on, you'll be able to help them better. You'll be able to accommodate them a lot better than you just going up to them and assuming. You'll be able to know that, okay, well, of this culture or how they feel, then maybe only women nurses should go into that room, or we should also try to get a woman doctor as well. So it'll work out a lot better, and you can avoid a lot of things by keeping your employees up to date on different cultures.
Okay, so also to piggyback on what you were saying, is it also true to basically say what are the signs that you should teach your employees to actually look for different cultures? Because I know that we're just talking about one culture here, but for different cultures, there's different sights and signs that you can see or pick up on. So like, how do?
Well, I really wouldn't want to say how you can catch up or notice, because off bat you might not know that this person is a Muslim just by looking at them. All Muslims don't, come in wrapped up in everything. So it's more of you kind of have to look at their chart and kind of figure out about them before you go inside of the room. So you'll have a knowledge of what's going on before you enter the room blindfolded.
Okay, that's fair to say. I understand that. I like that. In the court case of Zubik versus Burwell, there are many issues that take place in this case. The case recently just passed through the Supreme Court about religious organizations. However, it was basically, people had the feeling that it was a piggyback off of the Hobby Lobby case that took place in 2014, which was between Burwell and Hobby Lobby. But neither here or there. This is a different case. This is a different year. Going from there, piggyback to talk about the fact that it is about religious convictions, and that basically Burwell feels like Zubik should write a one-page paper talking about why they feel like they should not have to pay. Oh my bad. However, in this case, Zubik was here to challenge the fact that they didn't want to do a one-page opt-out for accommodations under the Health and Humanity Service contraception coverage mandate. And this was part of the ACA, which is the Affordable Care Act. Also, by the Health and Human Services, has emphasized on the importance of including contraceptives to help women, which basically they say it would put women on an even playing field as men, because in healthcare, men don't need contraceptives because they use condoms and other things such as that.
My name is Sabriana Lehans,
And I'm Samantha Toussaint.
and we're going to be talking about the ACA and health disparities. So first, we'll start off with health disparities. Health disparities refer to differences in the health status of different groups of people. Some groups of people have higher rates of certain diseases and more deaths and sufferings from them compared to others. The groups may be based on race, ethnicity, immigrant status, disability, sex or gender, sexual orientation, geography, or income. Before the ACA, health insurers routinely denied coverage to individuals with pre-existing health conditions or charged much higher premiums. In 2014, the ACA compelled insurers to issue health insurance regardless of the individual's health status. In 2011, the NHIS included questions capturing whether a person had been denied health insurance coverage, was charged a higher price, or was excluded from coverage because of health problems, and the reason a health insurance plan was not purchased. For example, whether it was because of a pre-existing condition. In the United States, people of color face disparities in access to health care, the quality of care received, and health outcomes. Compared with whites, people of color face more barriers to accessing care, which includes preventative services, acute treatment, and chronic disease management. People of color are also generally less satisfied with interactions with healthcare providers. The National Healthcare Disparities Report showed that white patients receive better quality of care than Black American, Hispanic, American Indian, and Asian patients. Although overt discriminatory behavior in the United States may have declined in recent decades, covert discrimination and institutional bias are sustained by subtle implicit attitudes that may influence provider behavior and treatment choices. As a result, patients of color may be kept waiting longer for assessment or treatment than their white counterparts, or providers may spend more time with white patients than they would with patients of color.
I will be discussing the ACA. During recent elections, President Obama's Affordable Care Act was up for debate. The Affordable Care Act provides Americans with better health security by putting in place comprehensive health insurance reforms that will 1. Expand coverage, 2. Hold insurance companies accountable, 3. Lower health care costs, 4. Guarantee more choice and enhance the quality of care for all Americans. After Republican candidate Donald Trump clinched the presidential ticket, many Americans worried that their health care coverage will end. During the election, President-elect Donald Trump proclaimed to his supporters that he will end Obamacare. However, in recent news, President-elect Donald Trump revealed he will keep certain facets of Obamacare, one being extending parental coverage for adults 26 and younger. Another provision that may be saved under President-elect Donald Trump is discrimination based on pre-existing conditions.
Speaking on the Zubik versus Burwell case, they were trying to equalize women's health care by helping women become equal participants in society to regulate a few issues throughout the case. And also, speaking on culturally competent care, is defined as care that respects diversity in the patient population and cultural factors that can affect health and healthcare, such as language, communication styles, beliefs, attitudes, and behaviors.
Well, moving on to the ACA, which is the Affordable Health Care Act. it will be changing in the next couple of months due to the fact that we have a Republican in the office now, Donald Trump. Basically, healthcare is going to be different. He's going to have different views from Obama, and things in that nature is ultimately going to change. Maybe for the better, maybe not. We still have to wait and see. But for health disparities, that's basically coming in the next part where, what health disparities are, it refers to the health status of different groups of people. So what it is basically saying is that higher rates for certain groups and lower rates for certain groups at a certain level of health. So a great example would probably be diabetes in the black community. You see it more in the black community. You don't really hear a lot about different other races having diabetes. So basically that is what health disparities is. But that's it for tonight's segment of the show. Thanks for tuning in to HNN, and have a nice evening. From me, and Curtis Walker.